Very good afternoon to all of you. So, what is cataract? This part of the eye is the lens in which the cataract is formed. The word cataract means seeing through a waterfall. How do you see through a waterfall? That is how a person who has cataract sees. So, it's cloudy, hazy, unfocused. So the lens is made up of mostly water and protein fibers. With age, all the proteins in our body get denatured, and that is how when the protein starts clumping together, and when they clump together, there is an osmotic imbalance, and that is how the water enters inside the lens, and that what gets the lens clouded. That is what is the reason for cataract. So the light does not pass through the lens and it does not focus on the retina. People start having different problems. The first problem which starts is glare. So what happens, because of the water particles which are inside the lens, the light starts scattering. It does not come to a point focus. So the vision becomes blurred, out of focus. The first thing which will start is the person will start seeing glare. As you can see in that picture, when you start driving at night, when you're driving at night nowadays, you're not so confident anymore. The light starts spreading out. You feel that nowadays I don't feel confident in driving at night. That's the first symptom which comes to each and every person who initially develops cataract. As such also, glare starts after the age of 40, 45. After that, your glare starts a little bit because the lens changes have started. But when they become disabling, they don't allow you to drive at night. That's when you have to get a cataract checkup done. The second thing which happens is problem in reading things. So when you have dim lighted conditions or you are inside the room, you do not see near things. It can be because of presbyopia also, but even after wearing your presbyopic correction glasses, when you still have reading problems, and that is when you have to get yourself checked for cataract. Blurred vision, you cannot identify people when they come near, then you can identify them. That's another problem which you can have. So cataract is going to come to each and every one of us. Each and every one of us is going to age, and each of every one of us is going to have cataract. It's very common after the age of 50. After the age of 50, you have to get yourself checked once a year. It can also occur a lot. So when you are dealing with persons who come to you in your OPDs, the most important thing which I am going to include in this topic is something called a radiation cataract and something called traumatic cataract. What is traumatic cataract? It occurs secondary to either blunt trauma or penetrating trauma. So these are different kinds of traumatic cataract which can happen. Glass blows cataract, it's because of infrared energy. Electric shock also can cause cataract. Ionizing radiation, especially in people who are working in the hospitals. Cardiac OTs, these are the people, chemotherapy, radiotherapy who are giving, these are the people who are at risk of developing ionizing radiation cataracts. So other things which can also occur along with this are glaucoma, retinal detachment, uveitis. So whenever you have a traumatic cataract, it will not be a simple cataract. There will be other comorbidities which you will have to find out, look out for these people. Mostly this happens in males. Male to female ratio is around 4:1. So males are more at risk for these traumatic cataracts. In blunt trauma, how does the cataract happen? We have all heard and read and been taught about coup and counter coup injuries. Coup injury means a direct impact to the lens. Counter coup is because of the shock waves which travel through the eye. So in these kind of cataracts, what happens is the lens gets, because of the shock waves, the lens gets stretched and it gets pushed anteroposteriorly, and the equator of the lens gets stretched out. So when you have a blunt trauma, a very common thing along with the cataract is the lens zonules which are holding the lens, they can also be broken. So you might have subluxation of the lens also very commonly along with the cataract which forms. Patients having blunt trauma in which there is no penetrating trauma, the eye is not open, have better prognosis after cataract surgery. So what is the kind of cataract you will see in patients like this? A stellate or a rosette shaped. Can you see the star shaped pattern? This is how the cataract looks like in a blunt trauma injury. Penetrating trauma, this we all know. If the cornea is cut, the lens capsule is cut, because of the lens capsule being cut, the lens is exposed, and that's how it becomes cataractus. So the disruption of the lens capsule causes a focal or a total cataract in such patients. These are the patients in which they have to undergo surgery immediately, because the lens fibers which are exposed now, which are coming out, can cause glaucoma secondary to that. So this patients, we have to take care of two things. One, the globe has to be closed. If it is an open globe, even if it is a sealed corneal tear, then also the cataract needs to be operated early, because the lens fibers which are exposed, which have come out of the capsule, now can cause glaucoma secondary to that. So this also has to be taken care of. Radiation cataract, partial opacity to the damaged cells. So what happens in radiation cataract is the cells, usually the lens fibers are coming from the equator. If the equatorial region, there are new cells which are undergoing mitosis, and they are making the lens fibers which come into the center. Whenever the radiation exposure happens, the cataract doesn't immediately start. It starts a few days later. It can be 1 or 2 years, or maybe many more years if the dose of the radiation is much less. So what happens is the equatorial cells are damaged. So those cells are damaged, but when these cells grow and then come in the center, that is when the cataract starts forming. So the cataract is seen mostly in cases of astronauts, intervention cardiologists, intervention radiologists, orthopedicians, radiology technicians. In these places, there is a lot of radiation which they are getting exposed to. Be very careful. These are the patients which we have to look out for. A person like this having cataract, you have to think about radiation. Because of radiation exposure, the cataract might happen. So this is how, what I was talking about, from the equatorial area, the lens, then they migrate towards the posterior pole, and that's how the cataract happens. It does not happen immediately, it happens a few years later. So whenever the cataract happens, the most important thing the patient asks is the cataract mature? Do I go for surgery? This is a very common question, and they always look out, we will be getting operated in the winter season. So nowadays, the cataract surgery is so advanced, it goes sub 2 millimeter incision surgeries are there. Robotic surgeries like femtocataract surgeries are available. We do not need to wait so long because the incision is small, it heals faster. The amount of restrictions on your lifestyles are much lesser. Initially, the cuts were larger. You were not allowed to take head bath for a month or so, and that is when winter seasons were supposed to be a better season. Nowadays, these things are not there. Another thing is, we need to understand that nowadays we cannot wait for the cataract to mature. Cataract matures, it becomes a complicated surgery. We need to understand what is the requirement of the patient. Is the patient still working? He's still not retired? Is he driving? Is he very active on the laptop or on the phone or something? What are his hobbies? Does he read a lot? These are the things which will decide when the patient has to get the cataract surgery done. So it does not depend upon if the cataract is mature, how much vision loss it has done. Even a patient with a posterior subcapsular cataract, which is in the center, with a vision of 6/6, might be ready for a cataract surgery because he's active, he's driving at night, he's reading a lot of books, he loves reading books, he's still working even after his retirement. So these are the reasons which will indicate that the patient requires surgery. You have to do the surgery if the patient's lifestyle is getting restricted. So that is the reason. That is when we go for a cataract surgery. So the decision lies not only with the doctor but also with the patient and how his quality of life is getting affected. There is no proven medication which can reverse cataract. The only treatment is surgery. There are many types of surgeries today. There is no hospital stay. We do not need to keep the patient overnight in the hospital. They can come in the morning. It's a day OT procedure. They can go home faster. It is stitchless, painless. The recovery is much faster. They can walk out of the procedure by themselves, and we mostly do the surgeries under topical anesthesia, not even a local anesthesia. An injection is given. Most of the patients are done under topical, that is under drops. So this is the important thing. Initially, the surgeries had a very large incision. Lots of multiple stitches were there. The incisions are much more smaller. The most important thing is now you can get rid of your glasses. The glasses which you are wearing, the myopic, astigmatism, all these powers also can be taken care of because the lens which we put inside your eye is customized according to your eye. So we take the measurements and we try to give you better vision for distance than what you had all your life. We can do that. There are multiple new lens options available which can help you with use no reading glasses. That is also possible. So yes, multiple lens options are available. We need to ask our doctor what is the best option for us, because there are multiple multifocal lenses available. There are multifocal lenses, trifocal lenses, extended vision, depth of vision lenses. These are the lenses which can opt for depending upon our lifestyle. So yes, let your doctor and you both decide what kind of lenses, what kind of surgery, when to do the surgery, and then you can have a much better experience. There are lots of advancements in surgery. Thank you.